Good morning, everybody. Welcome to Aspirico's webinar this morning. It's nice to see so many of you here from representing quite a wide range of countries we have today as well. So that's good to see. So today we're just going to be looking at real-time, data-driven quality and compliance. So we'll just get started with one or two people logging in, but we'll just start the webinar. So just to introduce your host for today, my name's Chris Tanner. I'm the client director for the UK and Ireland, but here at Aspirico. And just like most of the project and customer-facing team within Aspirico, my own background is actually from a social care background, not from a technological background. I've worked as a registered manager, area ops director, and worked as a consultant on various projects, particularly around social care innovation and the use of technology. I'm joined today by Lisa Jane Humphreys, who's our international client director. She's been with the company many years. Prior to that, she also spent many years as a manager and director in the social care sector. So we're both on LinkedIn if you want to come and find us, as is Aspirico. If you follow us on LinkedIn, keep up to date with what's happening. We have regular webinars, but there's also some other activity. We produce a lot of blogs, some podcasts, and also just to keep up to date with developments in the sector and with iPlanet, our care management system in particular. So just as a way of introduction, today we've been looking at this series of webinars. We've been looking at how social care moves forward as we emerge from the pandemic, which has affected everybody over the last year and a half, 2 years. And I think we started to see from our own activity, trends within the sector as people look to do things differently. The move to digitalisation has been quite slow in social care sector when you consider, other sectors. I mean, from my own experience working in social care, computer-driven point-of-sale systems were in retail sector 15, 20 years ago. Even pubs and bars and restaurants have been using technological solutions for a couple of decades now, and social care seems to be so far behind in that respect. So it's interesting as to why that may be, and I think there are a lot of funding pressures in the sector, but also maybe there's a resistance to changing process in such a heavily legislated sector. But what we found as an organisation in the last 18 months during this pandemic, a huge increase in inquiries, a huge increase in new customers, plus existing customers looking to adapt their systems in response to new ways of working. And these new ways of working are ways of working which have been advocated for many, many years, but the uptake's been pretty slow. So what we've been looking at in this series of webinars is how are we going to move social care forward? And what part does technology have to play in that future? And what are the benefits that providers have? Providers want to change, but there's no point in changing for the sake of change. So what do the providers stand to benefit in terms of changing their structure? We don't, what we're aiming for really is a real change in culture, a real change in ethos, rather than just replacing paper systems or legacy systems with a new system. We want to look at how can we change the whole system itself. If you look at examples such as the Netherlands, the Buurtzorg model they're using there, and you look at how in Wales the Welsh wellbeing outcomes actually apply not just to social care settings, but they apply across the board to things like housing and education, a much more integrated approach to improving people's lives, which hopefully we will see more of as we move forward. And so we're just exploring in this series of webinars what technology can do to facilitate that. So in particular, we've been focusing on social care service management. Particularly, we looked at supported living environments, but also this would apply to community services and also to residential services. So last time we looked at the main areas within management of social care services. The last webinar we focused on care and support planning, which is obviously the heart of any service. But this time we're going to be looking in a bit more detail at quality and compliance, what that means, why it's important, how it's measured, and the role of technology and the role of iPlanet in maintaining that. And within that quality and compliance, you also have location management. So that refers, what I mean by that are the additional activities that providers are responsible for outside of individual service users. So people who are supported have their service, but on top of that, providers have location and service level considerations to maintain as well. And also part of that quality and compliance and in managing that element of any service, you also have incidents, so things that happen that are unforeseen. So we're going to have a look at that today. So to start off with, what do we mean by quality and compliance? So in terms of measuring quality and in terms of compliance, there are a lot of overlaps, particularly in definitions and things like that. But really, for the purposes of today's webinar, when we're looking at compliance, we're looking at the compliance generally are external measures, external frameworks. So it could be from your regulator, so the CQC in England, care inspectorates in Wales and Scotland, HQIA over in Ireland, and the RQIA over in Northern Ireland. So you have, and there are normally frameworks around what is expected from a legal standpoint, as a regulatory standpoint. On top of that, that's going to be related to how you're delivering your care or support service. But on top of that, you also have things like employment law and health and safety laws, laws that apply to any business, not just the social care sector, which you are required to comply with. And as well as that, you have other external frameworks that a lot of providers will sign up to, such as driving out quality, and specific services, the mental health recovery star, for example, new directions over in the Republic of Ireland. There are many different frameworks. It's just a couple of examples here of what we mean when we say compliance. Quality, when we're looking at quality tends to be, in the terms of what we're measuring here, are internally driven. So they're normally governed or set by internal management as to how you're measuring the quality of your service, and what quality covers are the inputs that your service make or have, and then the impact that those inputs then have. And the main purpose of quality monitoring, of quality control, is an improvement driver. So you're measuring what you're doing and how it's working, and then going back and seeing how that information could be used to drive improvement on a continual basis. So within, as I said, these quality and compliance overlap considerably, and a lot of quality measures will be driven by the compliance requirements of a particular provider. But they work on two levels as well in a social care setting. So they work on an individual level. So all of the UK regulators in England, Scotland, Wales, Northern Ireland, and in the Republic of Ireland have an element of their regulatory framework that means that a service being delivered to an individual is safe, effective, responsive and caring. These examples are the CQC key lines of inquiry terminology, but there are direct correlations with all of the other regulators in the UK and Ireland. And then what they apply to on an individual level are the activities and the tasks of their particular support service. So they're more the planned events that are happening, but also there are reactive elements as well. There are instances, things that happen that are unforeseen or unexpected that need to be dealt with one way or another. And then something that I feel very, very passionately about, as does everybody at Spirico, and the whole purpose of the design of iPlanet, is the outcomes. When you look at quality frameworks and you look at compliance frameworks, even the regulatory frameworks that exist, they're still to this day in 2021 very heavily input driven. You're measuring how much time staff spend with somebody, how many people have you got on duty that day, how many times has this person done this task, as opposed to what happened for that person when this was done. What are the outcomes? How have we improved someone's life? How have we promoted their independence? And it's something that I think we're starting to move towards. A lot of commissioning bodies in England now are exploring outcomes-based commissioning, moving away from that time and task model that's been so prevalent, and also that time and task model is what really holds back the evolution of the sector. So that's when we're looking at it from an individual level, but also you have service level compliance and quality measures. So you're looking at, in the context of the regulatory frameworks, you're looking at those well-led, how, you know, the organizational structure, how safe, effective, responsive and caring, how effective is your service on an organizational level, not just on how it affects an individual. On top of that, you have workforce management issues and workforce quality issues to monitor. So how well trained are your staff? How regularly are they supervised? How are they developed? How are they encouraged to improve and reflect on their own practice? And just like individuals, you'll also have events and incidents at a service level or a location level. So these may be things in the health and safety space, for example, something that affects a service rather than an individual. And as well, and on top of that, you have things like the facilities and equipment. You know, these are all governed by other laws, other rules that maybe sit outside social care specific regulatory rules. But they still form part of your overall compliance and your overall levels of quality. So the main things that happen within a service, and the main thing that you're looking to measure in terms of compliance and in terms of quality, you have incidents and you have events. Now, again, there's a lot of overlapping elements to these descriptions and titles and things, but really for the purpose of what we're going to be talking about today and in general, an incident is normally something reactive. So within the social care space, it could be a safeguarding alert or anything else requiring a statutory notification, a death in service, something like that, medication errors. It would also include things like complaints. It would compliments as well. You know, health and social care organisations, particularly in the UK, are terrible at recording their compliments because there seems to be a real culture of fixing complaints and resolving safeguardings, as there should be, but at the expense of compliments. You may also have behavioural incidents, particularly in the learning disability space and autism, things like that. You know, behavioural and mental health as well. Sorry. So you know these, and then of course on top of these are normally issues that would occur on an individual level, but they can also be organisational as well. You can have a complaint about the way your service is run, not just a complaint about how Mr. X was supported or cared for. And then you would also have things like incidents, so you know, COSH, RIDDOR, things like that. So hazardous substances, health, you know, injuries at work, things like that. And these fall out of the remit of specific social care regulations, but they're still an incident and they still relate to your legal obligations elsewhere, Health and Safety at Work Act in the UK, for example. And I'm sure there are equivalents in the Republic of Ireland and all across Europe. And then when you're looking at an event, and the way we're talking about events tend to be more proactive, more sort of planned. So on an individual level, you might be planning events, which may be sort of the task-based events that need to happen, getting someone dressed, supporting them with meals, supporting them with medication. Or on a service level, there are things that you know you need to do, things that are planned in ahead of time. So regular audits. On those audits may be on the service quality from a social care point of view, but they may also be for those other service level things that we've looked at. So you're doing the safety checks, maintaining your facilities, You know, you need pat testing for your electrical equipment, lower inspections if you've got lifting equipment and things, as well as planning, you know, and on that workforce management side, training and development, regular meetings, things like that. So all of these things, you know, fall under compliance and quality, are required to be, you need to evidence that these things are happening and that you're dealing with them in the right way. So how do we monitor and measure these elements of quality and compliance? So when you're monitoring this activity, you will start off normally with your inputs. So that could be time and task based events such as delivering support or delivering care to an individual. It may be any other activities that you're carrying out as an organisation. So, you know, so that could be on activities you're doing with an individual service user. It could be activity that you're doing as an organisation to drive the organisation forward, or whether it's related to training, whether it's improvements to your facilities, whether it's winning new contracts, whatever it may be. So, and then all of these things need to be planned, need to be scheduled. So these are just some examples of the kind of inputs that a social care provider will carry out into their service. Then, these inputs require recording, and they have workflows attached to them. So that in the example of a safeguarding alert, let's say, or an incident, or if you've got something that's planned, such as these elements, that the service level elements, such as auditing or the other legal checks that you have to do and evidence, you have to log those. They often require investigating, and then you actually need to be carried out. You either deliver that service to an individual, or you need to carry out the smoke alarm testing or the fire alarm testing, whatever it may be. Once you've actually recorded and actioned that workflow, you need to look at the resolution of, so if it's, say, in a safeguarding or an incident or a complaint, then after the investigation, there needs to be some kind of resolution. There needs to be some kind of learning. And in terms of an individual service user, their outcomes can be measured by the quality of life. So how is their independence being maintained? How is their independence being improved? How is their lot in life improving because of the inputs that you've done, the inputs that you carried out, that you've recorded, and the workflows attached to them? What are these outcomes on a service level and an individual level? And the way that these are measured, in general, are through KPIs of some sort. So, with CQC in England, they're the key lines of inquiry. With the care inspector in Wales, you have the wellbeing outcomes. The health and social care standards from the care inspector in Scotland, etc., etc. These are just an example here. They similar KPI frameworks exist in Northern Ireland, Republic of Ireland, all across Europe, Australia, New Zealand. There are measures that define what outcomes you're achieving from the inputs that you're putting in and how you're recording them. You may also have internal KPIs. So these are normally management driven. So these are much more, so whereas those first set of KPIs there are linked to compliance, internal KPIs will often be much more linked to quality, which are management driven, improvement driven. So an organisation may set their own targets. They may be linked to their values. They may be linked to what they want to achieve in terms of continuous improvement, and these are normally management led. And then there are also contractual KPIs. So commissioning authorities, commissioning bodies will often set out certain minimum standards that have to be met in order for a provider to get paid for the work that they're doing and to maintain the levels and volumes of work that they're doing. So this is the challenge, or these are the requirements that health and social care organisations face in terms of measuring their quality, measuring their compliance on an individual and service level. So what does real-time data mean? So the real benefits of real-time data over, say, legacy systems or paper-based systems is, in terms of the rich data set that is produced, particularly in a system like iPlanet, which is highly configurable, is that you've got root cause analysis and trend analysis. So if you're looking at incidents, you're looking at events, whether on an individual or a service level, you've got instant access to data to see where the service is going. And you can identify problems, and that data can provide you with the answers as to why that problem happened. Or if you can see a trend of some level of quality either dropping or rising, you can identify why that is. Obviously, it allows you much more rapid response. So if you're through various means, you can identify problems that are occurring as they occur. So you're not waiting for that complaint to come in. You're not waiting for something to go wrong. You can see it happening. You can take action and get it resolved. This in turn leads to prevention as well. So by looking at trends, looking at root causes, as well as looking at rapid response to events and incidents as they happen, you can prevent them happening. You can prevent them escalating. And that all of that data feeds into an ethos of continuous improvement. That in turn has a kind of snowball effect, because the less time you're spent reacting to an incident or an event, and the more time you are, and the easier it is to prevent them happening in the first place. And looking at wider trends on an organizational level, you can put strategic measures in place to make those long-term improvements. And then this effect snowballs, so that you're reacting less and less, you're being far more proactive, and that allows organizations to spend much more time on the things that are important, which is achieving outcomes for individuals and ensuring a safe, effective, responsive service on a organizational level. So the tools that we use to do that, you need, you're recording what you're doing. There are workflows attached to the things that you've scheduled, the things that you want to do. So what tools have we got to measure this? So within iPlanet specifically, we have dashboards, so you can see what's happening as it happens across the organization or across the people that you work with. So you've got oversight on an individual and a service level. You have alerts and notifications. If something's overdue, something hasn't been done, something needs to be done and hasn't, you're alerted to it there and then, so you can respond to it as you need to, as opposed to waiting until you collected a paper file at the end of the week or whatever, and then you're being reactive and not proactive. You can, and graphical data as well, making that data easy to understand, so you can have a really quick snapshot overview of what's happening, which you can then drill down into. You can look at the data from a specific location, from a specific area, related to a specific individual, or you can drill down into a specific incident where what stage are we at in the investigation? Who carried out this investigation? What did we find? What did we learn? And all of these tools combine to provide those benefits listed above. And really, they just, and that's how social care providers can continue to improve their quality and their compliance at both levels.